Finding Hope, the Road to Recovery.
Hi, everyone. Welcome to the episode of Finding Hope, the Road to Recovery. On this episode, we're going to be talking about substance use prevention in schools and beyond. This episode is presented by Tarzana Treatment Centers and the Ayeneh Foundation. My name is Emily Guzman, and I am a program coordinator here at Tarzana Treatment Centers. And today, I'm going to be talking to Irene, who is a health educator with Tarzana Treatment Centers. Irene, do you want to tell us a little bit about yourself?
Hi everyone, so my name is Irene Rodriquiz. I am a health educator at Tarzana Treatment Center. I've been in my role for about 6 months now, and I enjoy doing the work, teaching youth, parents, whoever wants to learn about substance use disorder.
Okay. 6 months, you say. I mean, that seems to some like a short amount of time, but I really feel like you can learn a lot in those 6 months. So tell us, what do you like about the job? What do you don't like? Are there some difficulties to the job? What do those look like?
That's a good question. I feel like coming from a mental health background to substance use disorder, it was kind of like a shift change. But I feel like having a family member who was like a substance use, who used substances, it does expand my knowledge a little bit, and I feel a little bit more connected with other people who might be suffering with substance use, or just family members who have people who use substances heavily.
Yeah, I mean, I know that being impacted by someone or having a family member that uses substances can be super difficult. And I know a lot of the people that work within the organization have a history or have a background or have family members. So I think it's really important, and I think that experience is actually beneficial to your role and can actually teach you and help you teach others a lot more that way. So for today, we're going to be talking about prevention, right?
Yeah.
Can you please describe what is prevention? What does it mean? Describe it as if someone didn't know or had never heard that word before.
So to me, prevention would be stopping something from beginning or initiating to start. So for instance, an example I can give someone is putting sunblock on to avoid getting sunburn, or eating healthy to avoid being sick. Just the basics, so they have a general idea of what prevention is.
I mean, those are really good examples, Irene. It sounds like prevention is something that's really easy to understand and something it seems like common sense to do. If you're going to go out to the sun, put on some sunblock. That sounds really common though. However, being in this field with you, I feel like substance use prevention is something that, one, not a lot of people know about.
Yeah.
And two, not a lot of people understand. So how would you describe substance use prevention when you're combining the two together?
Yeah, so I would use prevention in terms of substance use as an individual or youth who are less likely to start using drugs or alcohol. So kind of giving them that the general description of preventing that, but also just decreasing risk factors. So this can be coping skills, or an increase in their protective factors and their strong ties to the communities. Mm-hmm. But also needing to address the factors before they begin or escalate to a higher level. Because I know sometimes people who do seek prevention have already initiated it, mm-hmm. or they're at a higher level of drug use compared to someone who is seeking prevention at an earlier stage.
Okay.
But to me, the key aspects would be education and awareness. So having early prevention, skill building, and just having strong community ties with family mm-hmm. engagement as well.
Yeah.
But to me, I think prevention is proactive. So rather than responding when it occurs, aiming to reduce the likelihood of it happening in the first place.
Yeah, that makes sense. I mean, a lot of the times when we think about prevention, I feel like a lot of people confuse it with treatment, right?
Yeah.
They're like, oh, well, go talk to a counselor. And at that point, that's not prevention, that's treatment. You're searching for ways to stop or discontinue use. I want to go back to something you mentioned briefly. You mentioned risk factors and protective factors. So very briefly, what are some risk factors that as community members, parents, adults, we can be on the lookout for like signs in youth? What are some of those risk factors you're referring to?
Yeah, that's a good question. I think to me, when I speak to parents, when I tell them like risk factors, it would be like the youth themselves, or like familial risk factors, but also like community risk factors.
Oh, those are good.
So for like the youth, or like maybe even the parent themselves, like having like gang involvement, or having like early initiation to use, or their youth just being like rebellious in general. And then when it comes to like family, so having substance use history in their family, but also like maybe having like family conflict within themselves, not knowing how to resolve their family conflict. But also maybe the child just suffers from like maybe like child abuse or neglect, and they're just a little afraid of speaking up on it. And a little bit more about community, I think it's like the availability or access they have to like resources in their community. And then just like community norms for substance use. I know a lot of times like the lower income communities have a little bit more like stigmatism when it comes to like substance use, or they're more prone to being like, oh, you know, just because you live there, like, I know you use drugs. But a lot of the time it's not really like that. It's just a stigmatism built around it. And then I think for protective factors, I think it comes to like the youth having like strong bonds with like adults. So it can either be like their family, it could be like a teacher, even like a cousin. And then caregivers who just talk about like substance use. I feel like parents are afraid to talk to their kids about substance use because they feel like if they start talking to them at an earlier age, they're more likely to start using at an earlier age since they're bringing up the topic. Or just the youth like having high self-esteem. You know, I feel like kids who have a higher self-esteem are more comfortable talking to their parents, have a less likelihood to like seek substance use. And also like the schools themselves, like the ties they have with the community, and then if they have any like consequences, like providing like help, like substance use education programs for kids who might be already like engaging in substance use.
Great. Yeah, no, I agree. I mean, as a parent myself, I think about the stage where I'm going to have to start having these conversations with my own son. And it is scary because I understand the point of like, if you bring it up, if they're not thinking about it, but you bring it up, they're going to start thinking about it. But I think in this day and age, you need to start having these conversations with the kids. And it is scary as a parent to think about when this point comes and how I'm going to approach it. And what if by the time I do it, it's already too late, right? And they're already like engaged in substance use. Yeah. So, I mean, there is no right moment. And I think from what you say, like, as long as we're having these conversations, it's going to benefit them, correct?
Yeah.
Like it's helpful. I also want to mention, you mentioned schools having information, providing information to students. So that's work that you do, right?
Yeah,
can you talk a little bit more about what that looks like, how you implement it, and how you take course in providing that?
So honestly, like I had mentioned, like I think parents play a critical role when it comes to like preventing substance use. And it comes about like how they talk to their children. So like I said, like you can start at an earlier age, but you're gonna have to use like age appropriate language when it comes to like speaking to your kids, but also not building a conversation of like fear or shame. Having more understanding conversation with them. So yes, they're telling you, and sometimes I know like youth are afraid to like tell their parents like, hey, I'm using, like, because they are afraid of the stigmatism they are gonna get. Right. So more like listening and understanding instead of shaming them when it comes to them being open and having that conversation. But I feel like also talking to your child about substance use isn't like a one-time event. Obviously, like, yes, you can start in elementary school, like as early as you want, having that initiation from like elementary to middle school, but continuing on even in their adulthood. Like even me now, I'm like 25 and my mom still talks to me about these things, right? Because she's like, you never know, like, yes, times were different back then, but there's always new drugs that come to the market, you know, or come to surface. So you have to become educated about these things.
Yeah, and I find that so funny that you mentioned about your own mom. I mean, I don't know if it's a cultural thing or if all moms are like that, but I still get the talk all the time. Don't do this and don't do that and don't be going out late and come home early. You know, it's like as a parent and as a caregiver, you want the best for your child. And so if you have to have these uncomfortable conversations, it's what you got to do, right?
Yeah. But I also think like setting like clear expectations, right? And I know a lot of the times my mom would always tell me like, yeah, like I know it's going to come a moment like you hang out with your friends and they're going to want you to try these things, but at the end of the day, like, it is on you. Yeah. Like, if you want to engage in it or not.
Right. And I think you and your team do a lot of that really good work, right? I mean, you guys are in schools in the Valley, correct?
Yeah, correct.
So in the San Fernando Valley. And you guys are providing these education workshops, correct? Yeah. So tell us more about that. I mean, how do you guys get into schools? What kind of topics you guys cover? What does that look like?
Yeah. So, I know we are in a lot of like the San Fernando Valley schools, sorry. And a lot of it is we already have relationship with the school. So, you know, we go in like once, sometimes just to do like a one-off. So it's like a one-time presentation.
Kind of like an assembly.
Yes.
Okay.
You know, or it can sometimes just be like the school picks the kids that they want in there, you know, because sometimes it is just depending, like, yes, they caught someone like using and they want to teach them like the effects of this. So it could just be that in general. But, you know, we go in, we do these presentations, and a lot of the times like they enjoy the presentations, like the staff, so they ask us to do more. So we do like cohorts. So the longest we do is like 10 weeks.
Oh, wow.
And like each week is like a different thing.
Okay.
But now I think like, you know, I know that like youth already know about like drugs, right? So a lot of the time they're way more educated than me, right? Yeah. So I can go and like tell them like, hey, like this drug is like this name and it's a little outdated, and they'd be like, oh, but miss, you know, like it's not called like that anymore, right? So it's funny to like be a little educated from like someone who's like in middle school, because you're like, what, like how do you know these things, you know? And I'm here to teach you. But I think you must acknowledge too, like, that youth are engaging in substances, right? Like I know sometimes like, or sometimes they're just honest with you in class, like while you're presenting them, like, hey miss, like I just use it because it makes me feel good, or because I just have too much stress or whatever I have going on in like their home environment. But I guess like acknowledging that also makes like the education part easier, instead of like being like, I know like kids know like don't do drugs because they're bad, like, right, you know, I know they know they're not really scaring them, right? It's just more like I feel like they're like, oh yeah, it's bad for me, but it's okay. I don't care. Yeah, I don't care. I don't mind.
It won't happen to me.
Yeah, it won't happen to me. Like, and I always tell them like, you know, like sure it can't happen to you, but it can happen to someone else, right? Right. Like, yeah, you don't want to engage the first time in something, but just because it's not causing a bad reaction to you, it's going to cause a reaction to someone else. Right. But, you know, you have to remind and make them understand that, like, a temporary use or satisfaction isn't really worth the dangers in the long run.
That's such a good point.
Because you think about the temporary, but never like, oh, if, like I said, like, sometimes they're like, a lot of the biggest topic is like vaping. So a lot of them are like, yeah, I did it once, but nothing happened to me.
I'm okay. I'm healthy.
I'm okay. But like I always tell them, like, you don't know, like we don't even know enough. Right. Like what could happen to you in like 10, 15 years from now.
Right. Yeah, and I think that's a really good point. And I did want to ask that, and I think you kind of answered my question. But I know previous substance use prevention programs like the DARE program, or even you know, just like say no to drugs, like those slogans that were all over school when we were younger and growing up, right? It's like, say no to drugs. Well, why? Because they're bad for you. But why, right? Yeah. And it's like, oh, you can die, you can cause cancer, you can, I don't know, just a bunch of scare tactics, which I think they're valid because they're true, right? You can definitely get cancer from smoking. You can definitely have an overdose and pass away if you take something that's laced with another drug, right? But the way that you have to explain it, and correct me if I'm wrong, is you have to give them the good and the bad. And essentially that means giving them the facts.
Yeah.
Acknowledging, hey, this feels good. And, things like, we're humans and we are, we rush to seek like pleasure and sensations that we like, right? But essentially, like you said, it's not worth it in the long run.
Yeah. Like, I think a lot of the times, like, or the biggest conversation when I have with like kids is when it comes to like vaping. And I tell them like, yeah, I understand, like, like in the moment you might be with your friends and it might feel good. But I'm like, you have to think about like smoking is like the number one preventable death, in the United States. And I was like, if you compare it to people who like are active, like compulsive smokers, I'm like, they know like the cons of like smoking, even if it's like a cigarette, right? Because a lot of the time like the older population smokes cigarettes, so they know like the health effects, but they're still choosing to like engage in these behaviors, right? So I'm like, you as a child like who's 12, 13, like you don't know like long-term wise like what can happen to you for vaping like from now till your mid-30s. I was like, we can't even tell you like what will happen,
right? And because it's such a new thing, right? And there's not enough information out there. So yeah, it's really scary. But I think, like you said, as long as you guys are delivering the facts, I think you guys are doing a great job.
Thank you.
Yeah. I also wanted to ask, Tarzana Treatment Centers has like SUD, right? Substance use disorder services, but they also have mental health services. So what role do you think mental health plays with substance use prevention specifically? How can we tie the two together?
So I think coming from like my mental health background, like obviously I would do intakes for people, like a variety of range, right? So it could be from like someone who's like in elementary school to like in their 60s, right? So a lot of it, when I would do these intakes, like they would tell me like, oh, like I would engage in substances or I'm still engaging in like substance use because it's so stigmatized to like seek help or like seek prevention.
Oh wow.
Or they just didn't have like I had mentioned earlier, like the access in the community, or like resources available to them, right? But I also think the connection between like mental health as substance use is like intertwined.
Right.
So having mental health conditions can both contribute to your use, but also like it can cause results from your substance use in a way.
Okay.
But I think proactively the key is like reducing substance use and the development of addiction. So like the earlier we start, the better it is, right? Because it's not going to lead to like a long time use.
Yeah.
But I think mental health, the key is like addressing the underlying risk factors that are there and like helping people build resilience and coping skills when it comes to like their mental health and their substance use combined.
Right.
But also helping reduce the stigma of substance use and having people like seek prevention. So not look at it as a negative way or having people just like feel like they're admitting to like a problem they have, right? Instead of being like, oh, like I'm so glad you're here to like seek treatment before it escalates to heavier use, right? Just like the 12 steps to like Alcoholics Anonymous, like some people might not be heavy drinkers, but they're there to prevent the heavy drinking, right?
Right.
But also like creating supportive environments for these kids. So even if it's not just kids, it could be adults. So creating like a safe environment for them. And I always tell kids too when we do like our presentations, like if you know somebody or if you need help, like I'm here, or you can always just like message me, or you can pull me aside to like talk. Like what I always want them to feel like they could confide in me, even though like I'm just there for 10 weeks.
Right.
Because those 10 weeks can make a big difference.
Huge difference. Yeah. And I like how you stated, you are there to support them and they can pull you aside. I think just letting them know that you're there for them is a huge benefit. Like you are literally creating a protective factor around them. You're becoming a trusted adult for them. And if that's something that they don't have available to them outside of school or outside of like you coming in, you doing that is super impactful. So thank you, Irene. Thank you to you and your team for doing that. Just to wrap up, I did want to ask one last question. What are some additional ways that you and your team implement these prevention strategies out into the community? So not just schools, but now into the community. And what does that look like?
Yeah. So like I mentioned in the beginning, like I am a health educator. So like it's in the name, it's in the job description, So 70% of my job is like educating kids, right? Or parents, like teaching them the pros and the cons of, like substance use and like preventing substance use. And the other like 30% of it would be, we are in these two coalitions. One of them is called like Communities in Action, and the other one is like Rethinking Access to Marijuana. I know that one in our next segment you are gonna go a little bit more into details, but I feel like being involved in like those coalitions that I didn't even know like existed before I started this job is like a huge like benefit, because once you yourself become educated, you can educate like your family, your friends, or having just access to like these free like resources, like it's so beneficial.
Yeah. So, I mean, I want to thank you for coming, for stopping by, for giving us this great information. I think that's a really good point to end up on. Once you're educated and once you educate yourself, you can educate friends, families, and other people that you come in contact with. So I think the end point that I want to make is that in order to prevent substance use, we have to educate ourselves on substance use. So that's some really great information, Irene. Thank you. Thank you for stopping by.
Thank you, Emily.
And we will see you guys in the next part of this episode. Thank you.
Hi everyone, welcome back for our second segment from Finding Hope, the Road to Recovery. In this episode, we are talking about substance use prevention in schools and beyond. This is presented by Tarzana Treatment Centers and the Ayeneh Foundation. My name is Irene, once again, and in this segment, I will be interviewing Emily. Emily, do you want to give us a little bit about yourself, your background and your role, and your job?
Yeah, so my name is Emily Guzman. I am a program coordinator at Tarzana Treatment Centers. And what my main role is, I oversee and I coordinate daily activities for an LA County funded substance use prevention grant. So my day-to-day is mainly just coordinating activities, creating and continuing relationships with schools to make sure that we are able to come into their campuses to provide this vital substance use prevention and education. I've been in Tarzana Treatment Centers working in prevention for 3 years now, and I have learned a lot during those 3 years, and I feel very lucky to be able to be doing this today and just giving you a little bit more of information about what we do and what we're available to do.
I'm so glad to hear that you've been here like that long, right? Because as someone who like works under you, like I learned a lot from you.
Thank
I
you.
know that you oversee like our grant, right? But can you tell us what are some ways that we get involved with the community besides like prevention in schools, like I had mentioned in the first segment?
Yeah, so I think this is the part where it's like the beyond, right?
Yeah,
so,
the beyond.
Yes, we're in schools and we do all that fun stuff and the presentations with parents and stuff. But I think what a lot of people don't know, and even a lot of people that work in Tarzana, right? Like they don't really know the extent of our program. We have huge community ties and huge community involvement. I mean, we really are in the front lines, right? Doing a lot of the environmental scans and community awareness that people don't truly realize is there. So like you mentioned in the previous segment, we are involved into community-based coalitions, right?
Yeah.
The first one, Communities in Action, also known as CIA, and then the second one being Rethinking Access to Marijuana, also known as RAM. And so within these two coalitions, we work with the series of community-based organizations similar to Tarzana Treatment Centers, and we come together and we really like just share ideas and share projects with one another. And currently we have two major coalition projects that we partake in, and I think those projects have helped us do a lot of our prevention out in the field.
Yeah. So I know that you mentioned like communities in action, like we both mentioned it, right? But can you like give me a little bit more detail about like communities in action? You know, for someone who maybe like isn't aware or like knows that they have this resource available to them?
Yeah, so Communities in Action is a San Fernando Valley based coalition. So we are a series of treatment and prevention providers in the valley. So like Tarzana Treatment Centers, I think there's like 5 or 6 other agencies that do the same exact thing as us or similar. And we come together once a month and we meet and we talk about the stuff that we're working on, events that we're planning, schools that we're in, activities that we're doing. And we come together and we use this as a resource to share and network with one another. A lot of the times there's a lot of opportunities that we're not aware of, but then another agency mentions and we can participate and take advantage. And it really helps us expand our reach. And I think it's super, super beneficial for us to come together that one time a month and discuss and share with one another.
Yeah, I think it is beneficial, right? Because I think you mentioned like they are all different like community based coalitions, but they're not all in the San Fernando Valley, right?
So for Communities in Action, we are specific to the San Fernando Valley. It would be like the other coalition would be more LA County wide, but Communities in Action specifically is San Fernando Valley based, and we are open to anyone who's interested in coming. So even if you're not working in prevention, if you have like harm reduction resources or treatment resources, so a lot of the members that join that coalition are also like small business or like trying to start their own nonprofit. So they join us and it's kind of like a stepping stool for them to come and learn from us, and they can share with us resources and we can share with them to help boost their footsteps in the community.
I think that's pretty cool, especially because you really never know, like, we're here in Tarzana, right? But you don't really know what's going on in like Panorama City or like Pacoima, right? So that's pretty cool. And I know you talked about like coalition projects. Like you mentioned, like, can you give me more like detail about those and like what you guys do, or like what are the like day-to-day things you do for those coalition projects?
Yeah, so we have 2 main coalition projects. The first one is the Alcohol Delivery Project, and then the second one is the Let's Make a Difference Project. So the Alcohol Delivery Project is basically what it sounds. We focus on reducing third-party delivery app availability to alcohol for youth, basically. So
like kind of like DoorDash, Uber Eats, like those type of...
Yes. So as you know, when COVID hit, a lot of people quarantined, a lot of people stayed home, and the popularity of these third-party delivery apps, DoorDash, Uber, Grubhub, increased, right? Everyone was ordering food through there, everyone was ordering their groceries, and a lot of people don't know, but alcohol is actually available for purchase through these apps. So kind of like a normal food order, you click the store or the retailer and you select the alcohol type or how many you want, and the driver goes, picks it up and brings it to your front door. The issue that we noticed when this increased in popularity is that a lot of youth were getting access to alcohol through these apps. So technically, drivers are required to pick up the order, take it to the person, and scan the ID. But as you know, like there's the option of leave at my door. And sometimes people can put in like their notes, like leave at door, don't knock, don't interrupt, right? So a driver who's just trying to do their job and, you know, receive a tip and do as they're instructed is going to just leave it there and walk away without knowing who that person they're delivering to is. And so the main purpose of this project is we partnered with local alcohol retailers, liquor stores. I think there's like even a couple 7-Eleven stores that we've partnered with. And we've created these partnerships to not only benefit us, but benefit them, and to help stop the delivery or help reduce essentially the delivery of these alcohol products to minors. So we created these like stickers and posters reminding drivers like, hey, you need to scan ID. This is what's required. This is what you're supposed to do. And so we have these QR codes placed in the bags of these products. And essentially the project at this point just kind of runs itself, and we use it as a way to collect data and try to make sure that drivers are scanning licenses or IDs when delivering products.
I know that you said like you partner with like liquor stores, but you don't think like they might be like afraid of like losing business when it comes to like partnering with you guys?
Yes. I think that's a very valid question, and I definitely see the point. It's like, why would they want to stop deliveries that are benefiting them, right? Essentially, that's the question. I think it's beneficial to both them and to us, right? Because as prevention providers, we want to reduce and prevent alcohol access, right?
Yeah.
But what a lot of people don't know is that when a driver does not scan ID when delivering alcohol, one, they are opening themselves up to fines, right? The driver can be fined, but essentially the liquor store can also be fined. And so a lot of the times I think this is a little bit unfair, because pretend, you're working at a liquor store, an order comes in, you package it, a driver who's over 21 comes in, takes it, and you don't know where it's going, right?
Yeah.
You just, here you go, that's the order, bye-bye, right? But what we were seeing is that a lot of retailers were actually getting fined because their products from their stores were being sent to the homes or to the access of minors. And so in the long run, this really does benefit both us as providers who are trying to prevent alcohol accessing youth, and also to the liquor stores. It may reduce their sales. They may have to get a lot of things, a lot of orders like canceled, but essentially this saves them from fines, from like even tickets or like licensing issues. So it really is a benefit for these alcohol retailers to partner and work with us. And that's what we want. We want them to partner and want to work with us to prevent and stop youth alcohol access.
Yeah, I think it's also beneficial or like interesting, because I feel like sometimes like liquor store owners or like 7-Eleven owners like really don't know, like at the end of the day, if they're the ones getting fined, right? Like I feel like if I was an owner of a liquor store, I'd be like, the person who's delivering this order should be fined, not me. So I feel like that makes a lot of sense. But I know you also mentioned like the Let's Make a Difference. Can you give me a little bit about that? Talk about a little about that?
Yeah, so the Let's Make a Difference campaign is essentially a campaign that's focused on preventing and stopping prescription medication misuse. It's not specific to youth, or I would say it's applicable to both youth and adults, but essentially what we want to do is get prescription medications off of the streets. I mean, we have a huge problem with like illicit prescription medications being made, right? There's a lot out on the streets in the black market being sold and manufactured illegally, right? Why would we want to add more of like legitimate prescription pills on the streets? You don't want that. We have enough already. And so what this campaign does is that it aims to reduce the number of prescription medication acquired illegally off of the streets. And so with this project, we actually have a series of pharmacies now that we've partnered with. Some are like small family-owned pharmacies. Some are like major like CVS and things like that. Major pharmacies like the franchises or individually owned that we've partnered with. And through this project, we have merchandise, so like keychains, stickers, magnets, and pamphlets and brochures that we go, and we also conduct like monthly check-ins. So we go, we deliver to them and like, hey, here's the material. And they help us by one, letting us provide this material to them. Two, they put it in an area that's easily accessible for the people who walk in, right? So, you're there, you're waiting for a prescription, and you see, like a keychain, 3 steps to prevent drug misuse. And then you pick it up, you read it. And it's a great way of educating the community on this, right? And essentially the main goal of the campaign is just to prevent prescription medications from being on the streets. And we really do push and encourage safe storage and disposal of medications. There's a lot of people that are on these well-needed medications. I mean, they're needed for medical reasons.
Yeah.
But if we're not storing them and disposing of them properly, that can lead to a huge problem with misuse, and that can lead to abuse and addiction and overdoses, as we know. Like, it's a growing problem. So the prevention aspect of this is safe storage and disposal of these medications.
So how do you go about like teaching like the community like the necessary steps taken for like safe storage, or like just teaching them like how to get rid of like their prescription medication that, you know, just might be expired, or they just don't use anymore?
Yeah. So I think the first one is the parts that we do, the education, right? So we have the education on like prescription medication and safe storage and disposal. These are the steps. This is where you can go. And that's just delivered to like youth or parents and families via presentation, right? The second one is we have this coalition project. So we have these partners and relationships with the pharmacies. When we do our monthly check-ins, we ask the pharmacies like, hey, are you interested in what we call a pop-up, right? If yes, for this month, or maybe not, no, not this month. But when a pharmacy agrees to a pop-up, is they're really allowing us the time and the space to come to their location, whether it's inside or outside of the pharmacy. We're able to set up a table. We're able to provide information, and we're able to talk to all the people that are walking by. We're able to just educate them. And if people just kind of want to walk by us, it's like, here, just take this with you, read it on your own time.
Yeah.
Like, learn about this, because it's super, super important. And then as part of our grant, our substance use prevention and education grant, we also have partnerships with the DEA. So we work twice a year in what we call the National Take Back Day. One takes place in April, one takes place in October. And these are essentially pop-ups that we do where community members, regardless of age and whatever, like, they just come, and we encourage them to bring us any and all prescription medication that is no longer being used or is expired, no questions asked. So we're there, we're at the table, we have boxes. A DEA agent also accompanies us. They're standing with us, and people just come, here you go, and exchange. We may give them like a keychain or a brochure with information. Here you go. And no questions are asked about what they're bringing, why they're bringing it, whose it is. Everything is just put it in here, and then it is disposed by the DEA.
Oh, that's super interesting to know. Yeah. Especially that, you know, you partner with the DEA, because I mean, I've partaken in, you know, one of those DEA events. So it's so nice to see that, like, you know, like, people have access to these resources. Yeah. But I also know that you do take part of the Rethinking Access to Marijuana. But is it exactly what it sounds like, or is it like something different? And can you just tell me like what your work with Rethinking Access to Marijuana looks like?
Yes. So Rethinking Access to Marijuana, or RAM, is our second major coalition that we take part in. So like I mentioned, the first one is San Fernando Valley based. The second one is LA County wide. So we work with organizations and providers from like all the way from Palmdale and Lancaster all the way to like Pomona and Whittier. And it's basically from all of LA County. Other providers similar to Tarzana Treatment Centers that provide similar resources that engage in prevention efforts. And this coalition is also open to community members who are interested and passionate about it. Like you mentioned, and like the name states, we are a marijuana-focused coalition. So we're not trying to oppose or support any laws. We don't lobby for anything. And we are definitely not trying to get rid of recreational marijuana or trying to get rid of legal adult marijuana use. Again, it ties back to prevention. We want to prevent youth marijuana use. If you are under the age of 21, legally, you can't consume marijuana. You shouldn't be. But we also want to highlight the importance of why you shouldn't, right? Because cannabis use at a young age creates harm to your brain, to your body. There's legal consequences, social consequences. And as you know, the human brain keeps developing until your mid-20s, right?
Yeah.
So by this age range, by 2025, many youth have already tried marijuana. Many youth are recreationally using it. And so we want to get to the core problem of reducing youth access. Because, like what you do, right, is the whole prevention and education and telling them to stop. So rethinking access to marijuana targets the availability and access of it. So dispensaries and smoke shops and things like that, we really do a lot of work with that. And we're really trying to reduce the availability and access to it.
Yeah. So is there like any other like parts to rethinking access to marijuana? Like, do you guys do like media like announcements or like, like read into like bills that might be coming into law or anything like that?
Yeah, that's a really great question. So rethinking access to marijuana is like I mentioned, LA County-wide coalition, right? Within this coalition, we have 4 different subcommittees. We have the media committee, who is responsible for social media, making posts and putting the name of RAM out there. They're responsible for disseminating and increasing our social media presence. We have the policy committee that is responsible for looking into all and anything like bills and policy at a local level. So LA County, at a state, in California, and then federally in the United States. So they are aware, they're educated about everything and anything cannabis or marijuana policy related. And they're really just there to make us, like the rest of the work group and the community, aware of any like laws or things that are happening surrounding marijuana. And then we also have the research committee. So research is a really, really good backbone to this coalition, right? Because they're the ones pulling stats, data, information, scientifically correct articles and providing us with that information. And then last committee would be the education committee. And so the education committee is really focused on creating and disseminating educational material so that the community understands. Because you and I, we know, and we can use like all the scientific lingo for talking about marijuana and the harms in cannabis. But if you're talking to a parent who isn't educated about this, or you're talking to a youth who isn't fully aware about the harms, we need to be able to make it so that they comprehend it, right? So we take all of the research articles that research pulls up, right? And we're making it so that they understand it. And so myself and the team, we are taking part in the education committee. I really think, like you mentioned, it's 70% of the work. And so we really use that as an extra to supplement that 70%. And I also chair the education committee. So I was the 2024-2025 education committee chair, and I will be seeking re-election this July. So I hope I get reelected, and I hope it works out, because we have a lot of really good work coming to cannabis prevention and youth access in the upcoming year.
Everyone go vote for Emily.
Yes.
Well, I think one of my big questions here is, how does your work with like the education committee like tie into like substance use and like prevention?
Right. I would say the main aspect, and you said it, but education. That's the foundation for everything. We can't blame people for doing things that they shouldn't do if they're not educated, if they don't know that it's wrong or they don't know that it harms them. So being in Rethinking Access to Marijuana and being part and leading this education committee this year, I think really does teach you a lot about the need for education, but also the different levels of education. Because even as prevention providers, you're not always aware of everything that goes on. You and I have good information on the prevention aspect, but we may not know as much about like the policy or the research, right? We have individuals that are there to break it down for us so that we can break it down and educate the community. So again, I would say the basis of prevention, education, putting out as much material as you can. This year, we put out a presentation on Delta 8 and other illicit cannabinoids. This presentation has already been distributed to prevention providers countywide. We have already used this presentation to educate treatment providers, school social workers, nurses, teachers, youth and adults on Delta 8, and we've also created already an infographic that's in process for distribution on the California emergency hemp ban on these Delta 8 products. So we're doing a lot of work surrounding cannabis prevention and, most importantly, youth access. Because like you said, if we can stop it at an early age, it's going to help so much and prevent addiction and substance use disorders.
That's honestly so good to hear. Like, you guys are creating like infographics for like youth, but I know they're also for parents. But I think my final question to you would be like, how would the community go about like maybe joining these groups, or like how can we inform the community? Is there like a charge? Are they free,
Yeah, no, so everything is completely free, no cost to anything. We are so lucky that we receive funding for these efforts. And prevention, I think, is still highly unknown. Not a lot of people know about it, and I would say there's not a lot of money being put into it. I think mainly everything focuses on treatment and harm reduction, which is great. I mean, we need it. Help us, give us the money for it, right? But prevention, the money that we do get, we're able to make it work, and we're able to make it so that it's free to everyone. So if anyone is interested, please, if you want to join Communities in Action, you can go to Communities in Action SPA2, SPA2.com. And then if you are interested in joining RAM, please go to lacountyram.org. All of these resources are available to the community. It talks about like our mission, our vision, what we do, the organizations that are involved in this. And it really, it's there as a free resource for schools, communities, towns, and anyone who wants to inquire about these substance use prevention services.
Well, thank you, Emily, so much for your time and
Thank you.
all the information you give us. This does complete our segment today. So thank you, everybody, for tuning in. And hopefully you guys tune in next time. Thank you.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.